Since it's very difficult to determine accuracy of localizing landmarks on human beings, we have developed models that will help us determine the accuracy of localizing landmarks and determining the degree of asymmetry. Here is an example of a lumbar model. In your practical, you will be asked to identify the transverse processes of L1 through L5 and determine whether the right transverse process is more anterior, is equal to, or posterior compared to the left side. So standing at the side where your dominant eye is in the midline of the table, facing towards the head of the table, you will first, like you would do on a human, identify where the spinous processes are. This will not feel identical to a human, but it will give you some simulation of that. The top spinous process, once you've identified that, you'll go through the same sequence you do with the human to have identified the transverse process. You go up to that inner space and you work your way out laterally about 2 fingers breadths distance to come upon the transverse process. And then you'll do the same for the left side and you'll compare. In this situation, I find that the right transverse process is posterior to the left. I then work my way down to L2 spinous process, go to the inner space, and then I work my way out until I find the transverse process, and I compare between right and left side, and the right side is more anterior to the left. In your practice, you'll have the opportunity to see whether or not you are localizing the transverse processes correctly, and you'll be able to uncover it, the models, especially when you are finding that what you localize may not be correct, and be able to see whether you are examining the structure correctly and whether you're interpreting the findings, the localization correctly. If you are only going straight out from the spinous process, you're going to be landing on facet joints. And so that's only about 1 finger laterally from the spinous process, so that can give you some challenge. And sometimes you could be on one side on the facet joint and the other side on the transverse process. That's another thing that we commonly see. As you can see, looking at the lumbar spine here, that the transverse processes, as you go farther down, they get a little more lateral. So that's also another thing that's important to appreciate. We have duct tape over the top of the spinous processes, just like it would be the supraspinous and interspinous ligaments, to give you that type of feel when you are palpating through the layers of soft tissue on the model.